All right. Well, we've given a couple of extra minutes. We might have some folks join us as we move on, but I definitely want to get us started. So good afternoon, everyone, and welcome. We are so happy that you're joining us to learn more about the transition to 988 in Riverside County. As many of you are aware, 988 is the national three-digit crisis and suicide lifeline. Today, we'll talk more in depth about the progress we're making in Riverside County, as well as what you can do to support these efforts. Throughout the presentation, we encourage you to drop any questions you might have into the chat. Our team will be monitoring the chat, and at the end of the presentation, we'll devote time to answering each of those questions. And before we jump into today's presentation, we'd like to take a moment to acknowledge our sponsors for today's presentation, which is the Riverside County Suicide Prevention Coalition, Riverside University Health System's Behavioral Health and Public Health Departments, and the Inland Socal Crisis Helpline. At this time, I would like to introduce Dr. Jen Carson from the Inland Socal Crisis Helpline to get us started. Jen?
Yes, thank you so much, Diana. It's so good to be with you and everyone here. I'd like to take a few minutes to introduce our amazing team that created this presentation and who continue to play an active role in Riverside County's transition to 988. As I go through and introduce the team, we would love to invite you to introduce yourself in the chat box. If you could tell us your name, the agency you represent, maybe tell us the city that you're joining us from. We would just love that. And if you could just go ahead and see our presenters, it's going to be Diana Gutierrez, who's joining us from Behavioral Health, RUHS, from Prevention Early Intervention. We have Rebecca Antion, who is joining us from RUHS Public Health. We have Maisha Bobo, who is joining us from RUHS Behavioral Health. Robert Youssef and Andrea Putnam are also joining us from RUHS Behavioral Health. And we have Carrie Maybe and Jose Abalo, who are joining us from RUHS Public Health. So we just so appreciate our team that is working so diligently on this transition to take Riverside County towards the 988. So we so appreciate you. So as we go forward to our next slide, I'm going to just share the agenda so that you know what type of content we're going to be covering today, because this is such a sizable transition. So if you look at our agenda for today's presentation, first we wanted to provide a little bit of context, the landscape of public health on a national level, on a local level here in Riverside County. And next we want to outline the relationship between the National Crisis Line and the tradition to 988. Then we will outline the historical timeline and purpose of 988, why we have a national crisis and suicide lifeline. And finally, we're going to share our local approach to supporting 988 through the ongoing transition and development. So, so here we're going to be talking briefly about America's mental health crisis. I think we would all agree that the 2020s are pretty challenging so far. I was expecting the roaring 20s. It hasn't happened yet, right? So too many people, unfortunately, are experiencing a suicidal, mental health, or substance abuse crisis, and they're doing so without the support and care they need. And sadly, the pandemic has only made the situation that was bad, it's made it worse. When it comes to mental health and America, unfortunately, we're just not in good shape right now. And there are urgent realities driving the need for crisis service transformation, not just here in Riverside County, but throughout our country. In 2020 alone, the US had one death by suicide every 11 minutes. And for people aged 10 to 14 and ages 25 to 34 years old, suicide is actually the second leading cause of death. Data also shows us that from April 2020 to 2021, over 100,000 individuals died from drug overdoses. These statistics support the need for a transformation and an expansion of our current system so that we're better able to care for those who are in crisis. Now, we'd like to kind of bring into focus our reality here closer to home. We want to look at data here in Riverside County, where we are all honored to work, live, play, attend school, what have you. So let's look at the data around suicide in Riverside County and the impact on our current prevention efforts. So from July 2021 to July 2022, there were 261 suicide deaths. I want to repeat that. We lost 261 individuals to suicide. And we had 1,967 suicide attempts. Again, these are our neighbors, these are our coworkers, these are our loved ones. 1,967. I have to pause at that number because I'm a suicide attempt survivor, and I need to remember that each of those are individuals. During the 2021 calendar year, there were 800 overdoses in Riverside County. These local statistics further signify the need for a more robust crisis response system in which 988 is going to play a really key role. Taking a look at the prevention side of things, as we click forward, during this same time frame, our data shows that there were nearly 5,000 calls to our local helpline. That is the helpline that I manage, Inland Socal Crisis Helpline, 686 HELP. So there were almost 5,000 calls, 4,980. Riverside County also averages about 11,000 annual calls to the National Crisis and Suicide Lifeline per year. During the last fiscal year, 5,908 individuals were seen at the 24/7 mental health urgent cares here in Riverside County and by RUHS Behavioral Health Mobile Crisis Teams. So I apologize that I just misspoke. So 5,908 individuals were seen at our mental health urgent cares, and 2,097 were seen by our crisis mobile teams. It's really important to understand the scope of the need here in our county. It's important to acknowledge the efforts that we are already implementing to keep our community safe and get individuals connected to life-sustaining supports. The high volume of calls and visits further indicates that an enhanced nationwide crisis response plan would expand support for those in immediate mental health need or in need of substance abuse services. So looking at this graphic here, we're going to see that a crisis continuum of care, So as you'll learn throughout today's presentation, the ultimate vision of 988 is about the development of this continuum, the crisis continuum of care. As you saw in our previous slide, Riverside County has begun this process with the implementation of mobile crisis teams and mental health urgent care facilities. We have many of the elements in place that 988 is striving for. The last piece is getting our local helpline. As I mentioned, that's where I serve, the Inland Socal Crisis Helpline, to be part of the 988 network of crisis call centers. At this time, we'd like to share a short video with you that illustrates the crisis continuum of care approach, how it works in helping enhance our local crisis response plan.
Imagine for a moment that a fire breaks out in your home, and in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the US. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs, call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
That was amazing. It showed you that entire crisis continuum of care that we're all looking to transition to. So now that you've had that overview of what that continuum looks like, we'd like to step back and provide some context around how we were arrived at our current stage in the 988 transition. This timeline actually gives us a more comprehensive view of the evolution around 988 from the initial funding for a national suicide prevention lifeline to where we are now with 988. Here we see that the National Suicide Prevention Lifeline began in 2005, and it was expanded over the years to include VCL, the Veterans Crisis Line, in 2007. Also expanded to include the use of chat service capability in 2013, and then the inclusion of the Disaster Distress Helpline in 2015. The Lifeline was created as a national network, which now has over 200 local call centers. These are independent crisis centers equipped to help people in mental health related distress or individuals who are experiencing a suicidal crisis. These crisis centers help these individuals via call, chat, or text. The Lifeline also provides free and confidential support to people in crisis, including those in suicidal crisis or mental health related distress. And they do so 24 hours a day, 7 days a week across the United States. In 2020, the Federal Communications Commission designed 988 as the new 3-digit number for suicide prevention and mental health crisis. In 2020, the National Hotline Designation Act was also signed into law, solidifying and codifying the national commitment to transforming crisis services and incorporating 988 as the new lifeline and the veteran crisis line. In 2021, the Substance Abuse and Mental Health Services Administration, that many of you know as SAMSHA, Veteran Affairs, and the FCC submitted multiple reports to Congress regarding the implementation of 988. A funding opportunity for 988 at the state level was also released in 2020, allowing the states to submit planning grants to receive funding to roll out 988 in their specific state. As many of you are aware, the soft launch of 988 occurred on July 16th. I'm going to be handing off now to Rebecca Antion from Public Health, who's going to share some more information.
Thank you so much, Jen. Okay, so as we move along, this transition to 988 stems from the ever-growing need for mental health and substance use crisis support at both the local and national level. So once fully executed, 988 will route callers to the national network of crisis centers where they may receive immediate support. So to ensure multiple supports are in place and available during this transition, the Crisis and Suicide Lifeline, formerly known as the National Suicide Prevention Lifeline, is and will continue to be operational. Shared infrastructure is currently in place between 988 and the Crisis and Suicide Lifeline to ensure that they're both readily available for anyone that needs services. So we just want to give you a few facts about 988 that we think you should be aware of. First, we know that 988 will provide greater access to 24/7 confidential and life-saving services by offering a streamlined approach to safely obtain mental health and substance use crisis support. Next, 988 will not replace the existing National Suicide Lifeline, but rather strengthen and expand it by increasing the infrastructure that supports it. And then we also have that 988 really, is just an easy 3-digit number to remember that helps provide direct connection to compassionate, accessible care. And last, we want to emphasize that 988 is intended to strengthen our larger crisis care system, just as we saw in the video a little earlier. So just giving you some fast facts, we also understand that it's important that you should have a better and clear understanding of what 988 is and what it isn't. So to ensure that you are sharing accurate information, we want to just let you know that 988 is meant to work with other established supports, meaning it's designed to complement other emergency supports such as 911. It's not meant to replace it. 988 is staffed with trained counselors that have experience in de-escalating a crisis, but cannot provide extensive or ongoing mental health support. Some things that you should know again about 988 is that it is not a standalone solution to supporting mental health or substance use crisis calls. It's meant to be a part of this larger system that we've been talking about. It's a system reimagining crisis service infrastructure and helping to transition those in crisis to key services for that ongoing support. And then also 988 is not a new service, it's just a new number. So we know that it's already existed under the guise of the Suicide Prevention Lifeline, utilizing that network of over 200 crisis call centers. So really changing the number to 988, what it ultimately is doing is it allows for a number that is easier to remember, and it helps fight against stigma towards accessing care. So we hope that this will be helpful for you in your outreach to your community or to the clients that you serve. And while we do recognize that this is an exciting time to reimagine how we provide services, on the next slide here, we're actually going to show you the vision for 988 and crisis services. So the vision of a transformed crisis care system with 988 at its core will not be built overnight. I think we all understand that. But it will require continued collaboration, commitment, and support to make it effective, appropriate, and most important, sustainable. And this support needs to come from both public and private sectors. So in the short term, we are looking to strengthen and expand the current Lifeline Crisis Center infrastructure and capacity to ensure that these trained crisis counselors are available to quickly respond to 988 calls, chats, or texts. We are also hopeful that a 988 crisis line that is effectively resourced and promoted will help end stigma towards those seeking or accessing mental health care, and will meet the growing need for crisis intervention. We also anticipate that the 988 crisis line will reduce healthcare spending when we move towards more cost-effective early intervention. And then in the longer term, our vision is to build a robust crisis care response system across the country that links callers to community-based providers who can deliver a full range of crisis care services. So if needed, we're talking things like mobile crisis teams or stabilization centers. The more robust crisis response system will be essential to meeting crisis care needs across the nation. So we envision a day when everyone across our country has someone to call, someone to respond, and a safe place to go for crisis care. So in talking about crisis care, it really kind of lends itself for us to revisit this crisis continuum of care approach that we learned about in the video earlier. The intent for each community is to build a continuum of care services to fully support a person in crisis. So essentially, this system would include someone to talk to, someone to respond, and somewhere to go when an individual or someone they know is experiencing a crisis. So first, we're going to start with someone to talk to. 24/7 crisis call centers will be that source that someone can access to talk with. All calls to 988 are to be answered by staff who are well-trained and experienced in responding to a wide range of mental health and substance use and suicidal crises. Crisis call centers are also able to connect people to additional services, including dispatching mobile crisis teams and possibly even scheduling follow-up appointments with local providers. Then we move into our mobile crisis teams, and that is where we are looking more towards someone who can actually respond. So mobile crisis teams should be available for people in crisis who need more support than what can be offered over the phone. So staffed by mental health professionals, including peers, these teams can de-escalate crisis situations and connect to a person connect a person to crisis stabilization programs or other services. So mobile crisis teams should collaborate closely with law enforcement, but only include police as co-responders in those high-risk situations. And then next we move to that crisis stabilization programs or facilities. And this is where we are really talking about that somewhere to go. So individuals in crisis will need more assistance from crisis stabilization programs that provide that short-term observation and stabilization. So these trauma-informed programs may also identify additional treatment needs, and they can provide a warm handoff for follow-up care from peer supports, or maybe to outpatient services, or even to more intensive services if needed, such as hospitalization. So ultimately, through this comprehensive approach, we aim to reduce use of law enforcement, public health, and other safety resources by increasing access to the more appropriate supports needed in these situations. So now we are going to cover ways that you can support the transition to 988 here in Riverside County. So for us, we've developed some action steps that you can take. The first is to continue to promote local and national resources. So, for example, local resources for us is the Inland Socal United Way Helpline. And you can even continue to promote the National Suicide Lifeline. So continuing that promotion of other resources would be key, in addition to 988. We also understand it's important to educate consumers on what 988 is and is not. We really want to help consumers understand the type of support 988 is able to offer and correct any misconceptions about what 988 is. We also need to stay up to date and educate the community on what a crisis continuum of care system is, how it works, and why support for this type of system is crucial to our community. And so as we move along in this process, remember to stay up to date on further developments during this transition period of 988. And then later in this presentation, very shortly, we'll share information on how you can receive the latest updates about 988 in Riverside County. So now I'm going to turn it over to Diana, who's going to share more about our local implementation of 988.
Thanks, Rebecca. So as we mentioned earlier, strong collaboration and support is necessary for the success of 988. We all have a part to play in supporting the ongoing development of a system that will ensure appropriate responses to mental health crises and increase equity when it comes to receiving mental health care. This collaboration and support is of extreme importance at the local level as we all work together to send a unified message of what 988 is and how we're handling the transition at a county level. Which leads us to our discussion of how we in Riverside County can support the implementation of 988. So first, we'd like to highlight the importance of coordinated and aligned communication about 988. It is vital that we use a common narrative so that consumers receive consistent messaging about what 988 is and how it will work to decrease false expectations or misconceptions. Having a common narrative also ensures continued safety and support for the communities we serve. It's also important to reference SAMHSA's 988 Partner Toolkit when you're creating any communication materials to ensure that you're providing key messaging that's easy to understand and meets the needs of your specific audience. Now we'll cover a few things we'd like you to consider during this transition period. First, we'd like to remind everyone that nationwide services are still in development, so challenges are to be expected. Some potential challenges we might see are the text feature not being operational in all areas and an increase in call volume with the promotion of 988. And as with any new system, especially one of this magnitude, challenges are to be expected. And this is why common messaging is vital to ensure our local communities continue to have access to services when needed. The Riverside County Suicide Prevention Coalition has established some recommendations that can help us provide a common narrative about access to crisis resources in our county. First, we encourage the promotion and use of local resources as additional options to 988. This includes local helplines, mental health, and substance abuse access lines. During this 988 transition, we also encourage continued promotion of the suicide and crisis line 1-800-273-TALK, or the crisis text line 741-741, which have established infrastructure that can support increase in call volume. The coalition encourages community partners to continue referring consumers to local and national resources. We'll briefly discuss our local resources from least to most restrictive along the crisis continuum of care. And so we're going to start with our local helpline first, and that's the Inland Socal Crisis and Suicide Helpline, 951-686-HELP. This is available for crisis support, and they're familiar with available resources in the county to link consumers to. And always a good reminder that any of these calls, someone doesn't need to be in dire crisis to get support from these lines. So really just the earlier someone reaches out, the better the outcome. So they encourage anyone to reach out that just needs someone to listen. Take My Hand is a mental health peer support chat line, which is an online virtual chat with a peer for support. A peer is a person with lived experience of mental illness who has the ability to provide support to another individual experiencing concerning thoughts, emotions, and behaviors. Currently, peer chat is available from 8 a.m. to 5 p.m. And that's not a mistake. So what you see there is takemyhand.co is the correct, we didn't forget the M, that is the full website. The CARES line is a great resource for Medi-Cal recipients or beneficiaries that are seeking mental health services for both mental health and substance use. And then our mobile crisis response units. These are field-based teams consisting of clinical therapists, behavioral health specialists, and peer support specialists that work collaboratively with law enforcement and emergency department personnel to decrease the need for inpatient hospitalizations, as well as decreasing the amount of time that law enforcement and emergency department personnel are dedicating to individuals in psychiatric crisis. The mobile crisis teams are able to work with individuals from all age groups. And also throughout the county, we have mental health urgent care centers. These are walk-in locations that are open 24/7. This is not hospitalization, and all the services are voluntary. It's a safe place for someone to go to who's experiencing a mental health crisis, like troubling thoughts, feelings, or behaviors, where they can receive support from paraprofessionals like peers, and also support from professionals like counselors, psychiatrists, and nurses. People can stay there for up to 23 hours, and they can also help and assist with medication needs. All persons over the age of 18 are welcome at the Riverside location, and ages 13 and above at the Paris location. And all are welcome regardless of insurance or ability to pay. Our emergency treatment services also provide psychiatric emergency services for all ages. Services include evaluation, crisis intervention, and referrals for psychiatric hospitalization as needed. And then last resort, there is 911 and emergency room. We do want to try to avoid having people call 911 and go to emergency rooms for mental health crisis by utilizing all of the things that I'd mentioned previously, but it is also an available crisis support as a last resort. We also want to briefly highlight resources at the state and national level. So the California Warm Line, which is 855-845-7415, is a non-emergency resource for anyone in California that's seeking mental and emotional support. The National Suicide Prevention Lifeline, 1-800-273-8255, and the National Crisis Text Line. You can text home or hello to 741-741 to find support through text. A licensed counselor will reach out to you via text for support. This could be a really great option and resource for young people or anyone who feels more comfortable reaching out via texting. And then the Trevor Project is an LGBTQIA crisis line that offers free confidential support from a crisis counselor 24/7, 365 days a year from anywhere in the US. So we encourage everyone to stay informed on the latest updates regarding the county's transition to 988. The Riverside County Suicide Prevention Coalition is dedicated to providing updates to the community regarding the latest development in this process. So stay tuned for more information from the coalition in the coming months. We welcome your participation in the coalition to learn more about local efforts to address suicide prevention. And if you'd like to learn more about the coalition and join the movement to end suicide in Riverside County, you can email us at pei@ruhealth.org for more information. And then finally, we'd like to share an interview that was done with our very own Dr. Jen Carson, where she shares the vision for what crisis care could look like throughout Riverside County in the coming years. This interview can serve as an excellent resource when educating the community on our local transition to 988. It can also be used to share trusted information on 988 from a local perspective. And you might choose to show this clip to consumers directly or use the common narrative reference throughout the interview to provide messaging that is consistent with local recommendations. We will put the YouTube link in the chat for your reference so you can have a copy of it if you wish. But for now, we'll just take a moment and watch.
The new 988 Suicide and Crisis Lifeline connects callers to existing suicide prevention lifelines. All new at 6, News Channel 3's Bianca Ventura takes a look at plans to expand 988 resources in Riverside County.
Jennifer Carson, supervisor of the Inland Southern California Crisis Helpline, describes what crisis care could look like throughout Riverside County in the coming years.
The goal is for anyone who is having suicidal thoughts or having a mental health crisis that they have 3 things. They have somewhere to call, they have somewhere to go, and they have someone to come to them.
Here in California, people can call or text 988 to connect with one of the 14 call centers throughout the state.
So if someone from Riverside County right now picks up the phone and calls 988, they'll be directed to a call center either in Los Angeles or San Diego?
Correct. Those are currently the 2 centers in Southern California.
The Inland Southern California Crisis Helpline is one of the oldest suicide hotlines on the West Coast and has been serving the Coachella Valley for 54 years. Carson tells me the call center is hoping to join the network of California's National Suicide Prevention Lifeline Centers. That would allow callers in Riverside County to dial 988 and be connected to local counselors and resources. Carson says this would be made possible through additional funding.
We really need the community to support funding AB 988, which will put a very tiny surcharge on cell phones to fund 988 in the same way that 911 is funded, because we all want someone to reach a trained crisis counselor right away when they call.
Carson also tells me the Riverside University Health System currently has a mobile crisis unit and is looking to expand this service within the next year.
So if a crisis mobile team were to come out to, say, your family in Coachella for a need for someone in your family, that would be what the team would look like. It would be a clinical therapist or social worker or peer support specialist.
The overall goal of 988 is to offer a range of services in the coming years.
It's estimated that calls are going to double within 1 year.
In Palm Desert, Bianca Ventura, News Channel 3.
All right, well done, Jen. So that is the overview of 988 and its impacts here in Riverside County. So we want to now give opportunity for questions. And I know that some have come through on the chat. But you can either, if you've got some additional questions that are not already in the chat, you can add them there, or you can feel free to unmute and we can speak to one another. So let me take a look.
Yeah, Diana, I see that one of the questions is, do we have electronic brochures or flyers that we can share out?
No, I don't think yet. But we can certainly put something together.
And there is a toolkit that's in place, correct me if I'm wrong, Dr. Jen, Diana, that we can share, which is SAMSHA's toolkit, and that talks just kind of widely about the implementation of 988. And it also includes information in terms of if you want to put on your social media pages, there's information on the type of graphics to include and messaging that you can include and things like that.
Yeah, and Behavioral Health and Public Health jointly put together a social media announcement on 988. If any of you follow our pages, you may have already seen it. And we're happy to share that image with you, to share on your own websites and social media pages through your organizations. And certainly, so we can get that out to this group as well.
The next question were, what plans are in place for facilities for teens and children? ETS is not user-friendly for them as ETS is not set up for this population. I do see that Susanna mentions that RUHS Behavioral Health has been working on grants to support a children's mental health urgent care, which could mitigate some of those issues that they're facing when transported to ETS.
Yeah, and those are definitely still in the planning stages. So for the right now, we do have our crisis stabilization or the mental health urgent cares that do accept as young as 13 in the Paris area, as well as our mobile crisis response team. So they respond to all ages. So if there is a young person that is in crisis, that can be a resource as well.
And then we also have someone's requesting that we add the link for the toolkit in the chat. And, you know, we are going to be sending out handouts of a copy of the presentation that was given today. And so additional links can be sent at that time as well to ensure that you receive all the information at once. So you'll have it readily available to you. So we can make sure that's in place for you. And then we also have another question here. So what steps are in place to address the need for cultural congruency or cultural competence in the mental health services that will be a part of the 988 effort?
I can answer that one if you don't mind, Rebecca.
Absolutely.
So during the planning period of 988, there was a lived experience committee. So I shared with you earlier that I'm an attempt survivor with lived experience. So there's a group of individuals such as myself that were meeting with SAMSHA and Vibrant. Vibrant is the company that manages the network of the 200 centers. So there were also suicide loss survivors, an individual who had lost someone to suicide. They were informing the plan. And then there were indigenous groups as well as other BIPOC groups. So for example, there was a group of African American, Black Americans who were meeting, and also individuals with disability in order to inform this, which is part of a movement to decouple policing from crisis services, just as 911 decoupled policing from medical services in the 1970s. And so informing that process. So there are standing advisory committees that continue to meet with the 988 team.
Wonderful. Thank you so much, Jen. And then again, let's see, questions about additional resources, if they can be included in the chat. We can make sure to get more information out to you all. And then we also have here, it says, gosh, it is being mentioned as a soft launch. So is it only for Riverside County at this time?
No, 988 has launched nationwide on July 16th. I think the reference to soft launch is that this is an evolution. So we have quite a bit of development across the nation. Each state, each county within each state is in its own place in terms of being able to respond in this comprehensive continuum of care approach. In Riverside County, we're pretty fortunate because we already have some mobile crisis teams that are in place, active, and we are expanding, as well as having mental health urgent cares and our local crisis center, our call center. I think that one of the next important steps for us is to have our local call center be a part of the 988 network so that any Riverside County resident that calls either 951-686-HELP or 988 will get a local response. So that is a goal, and we are working closely with the National Lifeline to be able to have that access to the network. And in the meantime, when someone calls 988, they get a response from the closest call centers, which right now for us is in Los Angeles or San Diego County, or they can call our local call center directly, 951-686-HELP. So it's a soft launch, just meaning this is going to be a process that takes time to develop that full comprehensive continuum of care and crisis services.
Okay, thank you so much. It's also a question around, yes, we will be adding a copy of the presentation and providing that to everyone. I want to just answer that very quickly. Another question here is, with the emphasis on message alignment, is there any alignment between Riverside and San Bernardino counties?
We have met with our partners in San Bernardino County already on this topic to begin to talk about the conversation. They are in a very similar boat as ours, as their local closest call centers are also LA and San Diego County, and they utilize our local 686 help as well. So we have had those conversations and are hoping to share all materials and information in the same way across both counties.
Great. And another question here, if someone were to call 988 and hang up, would 988 be able to call/locate the individual?
Let me go ahead and answer that as a suicide hotline manager, what that process is like. So crisis lines are intended to be anonymous, and sometimes a teenager will call and mom will walk in and they'll hang up. Or a friend walks in and hangs up. So our crisis counselors at most crisis centers utilize their discretion. So if they were to hear something concerning, they would likely do 3 attempts to call back just based on having the caller ID to check on that individual. So, but if there was nothing concerning, we would likely just respect that person's privacy, thinking that maybe a spouse walked in or a parent walked in or what have you, and give them an opportunity to call us at another time.
And I think that there are potentially plans, Jen, correct me if I'm wrong, that geolocation may be part of the 988 picture, but at this time it is not. So the way that 911, they can tell where you are because of tracking the call, 988 is not yet set up in that way. And I see a similar question in the chat asking, do they direct your call based off of the phone's area code or the location? So right now they're all based off of area code. So if someone who lives in Riverside County calls with a Riverside County area code, they will get routed to the LA County call center. But if someone lives in Riverside County, but they have an old phone number from when they lived in Texas, they will get routed to a Texas call center. Is currently how the Suicide Lifeline works.
And then I think there's kind of a second part of that question, Diana. I might be wrong, but just like the process of when crisis lines utilize the police. And so I just wanted to convey to everyone that, typically industry standards, we hear this from the 900 suicide hotlines, crisis lines all around the country, especially the 200 in the network. It's typically only about 1% of individuals are in imminent danger, and all crisis lines are prepared to get emergency assistance for those individuals. And geolocation would be the step to, ensure that. But law enforcement is not involved in the 99% of the other cases.
Thank you, Jen. Okay, so it looks like we've gone through most of the questions that were included in the chat. Is there anyone that has a question that they would like to answer, or ask themselves by unmuting? Okay.
There is another question that came in on the chat. To help promote the crisis line 988, are there other forms available besides electronic media? So certainly creating any flyers or brochures based upon the toolkits, imaging, branding, and messaging are certainly something that can happen. I don't think we have any of those right now, Jen or Rebecca. I think at this point we've been doing mostly electronic.
Electronic social media content is what we have available right now. And we're also understand too that for any organizations that are on the call today or have consumers specifically, we want to just provide you with some recommendations so that you can incorporate this information into existing correspondence that you have with your community. So if you have newsletters, or if there's flyers that you send out regularly or announcements that are sent out, you'll have the information on those local recommendations. And then you also have the toolkit, so you know how to include the proper logos and whatnot. We also have a question here. Let's see, maybe I missed it, but will there be subject matter experts who speak Spanish or other languages? Okay, and I see Dr. Jen shaking her head.
Yes, so 988 is required to provide services currently for individuals who are deaf and hard of hearing, is required to have some of the 200 networks are classified as Spanish providing crisis lines to make sure that there are 988 services in Spanish, and then other languages are provided via translation of, I believe, 200 other languages. So yes, that's a great question.
Thank you, Jen. So the next question, with potential for increase in demand for somewhere to go, what is being done to increase accessibility at the mental health urgent care centers? Some are reporting a long wait time or not being able to be seen the same day.
The department works every day to be able to support the needs that are in the community as it relates to access to the mental health urgent care. Currently, I know our desert urgent care is in transition as they're looking for a new provider for that service in the desert. So that will be in place hopefully very soon. And I will certainly make sure that the administrators over our crisis supports are aware of this question and concern in the community. But the department is always striving toward making that accessible when an individual needs that support, that they get it as soon right away.
Great, thank you, Diana. We also have a question here. Will you be creating more content for us to share out on social media? And I believe as a coalition, there has been discussion on that to support everyone here today and those who were not able to join us today by offering additional content. And we will continue to work on that. Just to let you know, when we develop content, we really take a strong look at it. So the information is highly vetted. We want to ensure that we're providing you with the most accurate information. So it does take a little time for us to get that out, but we just want to make sure that you know that we are working on that piece.
Yeah, and as the coalition has developed it, we'll make sure to send it out. We now have your email addresses, so you'll get things from us related to this information. And certainly you're welcome to check out the toolkit and utilize the branding and resources there to create your own. I see Dakota has created one and added it to the chat for anyone to use. So feel free to check that out. And if any of you create something cool, share that with us too. We're doing this together as a community. And Shirley says that at Inland Socal United Way, which is our local helpline, that over 50% of the operators speak Spanish, which is awesome. So that's why we want to continue to promote our local helpline. Other questions or comments?
So another question is someone who unfortunately had to join us a little late and may have missed this. They just want to know, when does 988 go live in Riverside County? So 988 is now live in Riverside County. And as we were sharing, it is accessible to anyone everywhere in the United States, including Riverside County. As we continue to watch the progression of 988, we were just reiterating the importance of sharing local resources so that our local community will continue to have a slew of resources available to them in addition to 988. Okay.
Any other questions or comments? You can feel free to unmute or put it in the chat.
These questions have been amazing. So thoughtful, so community-based. Any more? Keep them coming.
What's the Instagram username for what, Francis?
Oh, for RUHS Behavioral Health.
For the Behavioral Health Department? Robert or Andrea, you're on the line. Is that right? At RUHSBH, yeah. Perfect. And you can find us on Facebook as well. Okay, so we are done early, but we're here for a few more questions. If anything's coming up, we will be sure to share out any updates with this group and our larger networks and ask that you share that along with those that you are working with as well. If you have any questions, you can feel free to reach out to us by emailing pei@ruhealth.org, and anyone from our team will be able to respond and give you any supports or answers to your questions as best we can. So we are still here to support you even after this presentation. And so if there aren't any other comments, we thank you all so very much for your attendance today and wonderful questions, and you'll hear from us.
I have one last announcement. Diana, you and Rebecca invite everyone to join the Riverside County Suicide Prevention Coalition, right?
Yes.
Absolutely.
And you can do so by emailing pei@ruhealth.org. If you're not already a part of our coalition, that's how you get to be a part of our coalition. We have 8 subcommittees now working on the different objectives within our local strategic plan. So if this is all new information to you and you want more, email us and we will get you a copy of the plan and the list and calendar for all of our subcommittees. We'd love to have you a part of it.
Hi.
I'm sorry, can I also
throw in a quick share for if anyone is looking for training for your staff, you can also email Dr. Jen. She'll be more than happy to work with you and doing any presentation for you and your team. So if you're in Riverside County, we would be more than happy to assist you with any kind of training like that. So looking forward to helping everyone.
Yeah, thank you, Shirley. We have lots of suicide prevention training that the Helpline is part of our larger training team here in the county. And we offer several different options as it comes to suicide prevention that we can offer here at our local conference center at Behavioral Health, or we can take it to you at your site as well. So if that's something you're wanting to learn more about, whether that's Know the Signs, Safe Talk, Assist, or mental health first aid for youth or adults, you can email us at pei@ruhealth.org and we will get you set up with a training.
And so great that you and Shirley mentioned training because Suicide Prevention Month is in September. So
That's
it's
right.
a great time if you're, part of our library system or, it's a great, or you're part of our community college system. It's a great time to have, behavioral health or us at the crisis line come help you do a training. It's a great time.
I just have a quick announcement. Peace from Chaos in Blythe is having a National Suicide Prevention Day on September 10th. We're looking for more resources to come out to the desert and have a little resource booth. If anyone's interested, I'll drop our email address in the chat for anyone who wants to come out.
And Fran, I'm coming out, so
yes,
let's have lunch together.
Yes, absolutely. We'll be passing through that way this evening. We're actually doing the assist training tomorrow and Thursday. So we'll be out in Riverside County the next couple days.
That's very exciting, Francis. I hope you enjoy the training, you and your team.
Well, thank you all so very much.
Question? If we sign up for wanting to get more suicide training, do we do it through CORE or just email you first, PEI?
Do you work for the department?
Yes. Mhm.
There are a couple of trainings that would be listed in core, but you can email us and we'll let you know the upcoming dates.
Okay. Okay, thank you.
Mhm. All right, so we're going to hang out just in case there are any final comments, but otherwise we are done. Thank you all so very much for attending today, and we'll look forward to our future partnership. Thanks so much.